Hello, this is Dr. Veronica Contreras, family medicine physician, and I wanted to go over some information on strokes. I work in urgent care, and sometimes patients will show up here with stroke-like symptoms, things that we actually shouldn't be seeing here in the urgent care, but that should be seen in the emergency department. So I wanted to just go over some of the signs and symptoms that you can watch out for so that you can get either yourself or your family members to the ER as soon as possible. And there is this acronym which is called FAST. I'm just going to show it here. Hopefully you guys can see it. And so what you're looking for in people that are having stroke-like symptoms is if they are having facial drooping. So this is what the F stands for. You ask them to smile and they can't. You see one side of the face is drooping more than the other. And then you have here arm weakness. So if one of the arms is weak, they can't move it, their leg is weak, they're having weakness on one side of the body, that's another symptom. As well as S is speech difficulty. So if you notice that they're talking normal and then all of a sudden they are slurring their speech or you can't really understand them and it's not something that they've had before, it's important to pick up on that and make sure that you are getting them into the hospital right away, calling 911, especially if you have the facial drooping, the arm weakness, they can't walk, they don't have a steady walk is another symptom. And so if you ask them to repeat something and they don't repeat it correctly or you can't understand what they're saying, patients or family members or people that have a higher incidence or that have diabetes, they have high blood pressure, they have heart conditions, they're more likely to, if they smoke, they're more likely to suffer from a stroke. And so it's important that you get them to the hospital right away as soon as you find those symptoms, or if you're at home by yourself, if you're able to call 911, call 911 so that they can get you to the hospital right away. Things that you can do to prevent from having a stroke is making sure that you have enough medication. I know that it's been hard to get into your primary care physician at this time because of COVID and the pandemic, but making sure that your medications have refills, contact your doctor, make an appointment with telemedicine if you have to, and so that way that you can get the refills for the medications. Making sure that your sugar is well controlled, avoiding processed foods, eating healthy, avoiding sugary drinks, sodas, juices, anything that has a lot of carbohydrates that are unhealthy, making sure that you're eating green vegetables, fruits, more natural, products or foods that you can grow yourself, and so forth. And so I just wanted to, hop on here and make sure that you are watching out for these signs or symptoms of stroke, and that you make sure that you get your family member or yourself to the hospital right away. If you come to the urgent care, it wastes time, and so we have a limited amount of time for you to be able to get to the hospital and to give you certain kind of medication if you have a certain kind of stroke that's caused by blood clots, in order so that you do not have any, later on have any deficits. And so if you have any questions, feel free to reach out to me. And if you'd like to schedule a telemedicine appointment, I'm available through rodocs.com. And again, I'm just putting out this information to hopefully help you guys out and help save lives. Thanks.